Hello everyone, I'm Dr. Amit Karajagi. I'm a practicing pediatrician in Thane and Bhandup area of Mumbai. Today we are here to discuss on a topic called as how to sleep train your infant. This topic I feel is the most neglected or not many parents are aware about this topic. Everyone is fond about the weight gain, the growth, the feed, the diet and etc thing. But when it comes to sleep training, not many parents are aware there is something called as sleep training where you can teach the baby to fall asleep and you can have a better social life. What I have seen in my personal practice is babies usually they tend to sleep in the daytime and are awake in the night time to begin with in the first 1 to 2 months, right? But with the time this circadian rhythm needs to be changed. That is, the baby should have a decent amount of sleep, a good night sleep, and in the daytime maybe couple of hours of short naps. But many parents are not able to achieve this goal because they don't understand there is a concept called as sleep teaching or sleep training their babies or infants. So today we are going to discuss few methods. I'm going to share few tips where it will help you as a parent to put the baby to bed. Why is this topic important is because most of the parents coming to me, they start going to work or they start working by the age of 6 months of the baby. And what they come to me with the complaint is that the baby keeps on getting up at night, the baby cries very frequently at night, because of which we as a parent are sleep deprived. It is affecting our work life, our relationship with each other, and we are more irritable, we are getting depressed, we are having anxiety. So many difficulties parents are facing just because we don't understand the concept of training our baby to fall asleep, right? So let's start with the topic how to sleep train your infant. The first thing is ki what exactly is it? Sleep training means you are making the baby to fall asleep without swaying, without handling the baby, without cuddling the baby or rocking the baby. It means the baby should fall asleep without any kind of physical stimulation. The baby should be able to self soothe itself and fall asleep. Now, sometimes it might feel that we are being cruel, it might be a little bit harsh. I would say it will be harder for a mother if I'm saying using this statement that we need to let the baby self-soothe and not give any kind of physical stimulus. It can be very difficult for a mother. But trust me, once we discuss the methods, even if you feel that it might not work, but all the articles, all the research which has been published over a period of decades, they say that these are the tested methods and baby do understand that and baby do fall asleep, right? So the first and foremost what I would like to tell you is about the methods. The first method which not every parent enjoys or likes is cry it out. That means if you place the baby in the crib, you need to let the baby fall asleep on its own. How do we do that? First, make sure that the baby is fed properly. Whatever the diet is, you need to give that baby properly. Second, do the daily bedtime routine. Baby bathing, maybe cleaning up the baby, putting on the diaper, putting on the clothes. If you sing the baby, sing the baby. If you read out something, read out. So that proper diet, proper routine which you do prior to bed is to be done. The time has to be fixed, right? Whatever time you are putting the baby to bed, it should be same on each and every day. I have seen with some parents where Monday to Friday they have one schedule, Saturday Sunday somehow they allow the baby to sleep late in the night. So this discrepancy causes break in the sleep cycle. So no matter what, 7 days in the week the schedule should remain the same. So first we said the baby should be fed well. Second, the routine should continue, whatever routine you are following. And third, it should be consistent. It should be on all day long, all days in the week, right? Once you do that, see whether the baby is drowsy. If the baby is drowsy, place the baby in the crib, making sure the environment around the baby is safe and there is no harm being done to the baby. Once you place the baby in a drowsy but awake state, you need to move out of the room. That is, your presence should not be around the cradle in the room. Absolutely no. Sometimes the baby will cry. but you are not supposed to go in the room and soothe the baby. This is the concept of cry it out. That is, when you leave your baby in the crib to cry, the baby will understand that thing, and with time, the baby will stop crying and self soothe itself and fall asleep. I understand it's a very difficult thing for me to ask a parent to do, but this is the most trusted method, and I have seen within 3 to 4 nights of doing such kind of method, we have got excellent results. The problem here is कि mothers are not very comfortable. They, as soon as the baby starts crying, they want to go in, pick up the baby and soothe the child. So here comes the second method, where with a little bit modification of this, we call this as Ferber's method. What does Mr. Ferber, who is a sleep study doctor, what did he say is ki, okay, if you cannot stay outside of the room, maybe when as soon as the baby cries, just come back in the room, and when you come back in the room, do not pick up the baby. Just, if you want, you can just touch the baby, or maybe sing a song, console the baby with your sound, and let the baby know that you are around the baby and the baby is safe. So when the baby understands that my mother or my father is around, the baby will calm down, and with time the baby will self-soothe and baby will fall asleep. So what is the difference? In first, you let the baby self-soothe and you did not come back until there is a time for second feed. Whereas in Ferber, as soon as the baby cried, you went in without picking the baby, without rocking, without swaddling, without swaying. You just touched the baby, calmed the baby down, and then let the baby self-soothe and fall asleep. The third method would be picking up and placing it down. That is, in this method, you allow baby to cry, but as soon as the baby cries, you pick up the baby, you calm the baby down, but before the baby falls asleep, you place the baby back in the crib and allow the baby to fall asleep later. So here the anxiety of the mother comes down because the mother is able to pick up the baby and calm the baby down. But the time required for teaching the baby to fall asleep is far more as compared to the first two methods. Because here you are picking up the baby and you are doing some stimulation so that the baby is calming down. Here we are not teaching the baby how to self-soothe, maybe a bit. So a fourth method where it says कि we need to phase it down or we need to increase the time duration. That is, if suppose you place the baby in the crib, you go out of the room, but you hear the baby crying. So let's wait for 2 minutes. See if the baby is self-soothing or not. If baby self-soothes, well and good for everyone. If the baby does not, you go back in the room, you touch the baby, calm the baby down, and again move out. After a few minutes, if you hear the baby is crying again, this time you wait for 3 minutes. Let the baby self-soothe. If baby does not self-soothe in 3 minutes, go back in, touch the baby, talk to the baby, sing to the baby, let the baby fall asleep. Then come out of the room. Now, most of the babies will fall asleep in 2 to 3 go. But suppose the baby is still continuing to cry, just look for if at all anything else is happening, whether the baby has wetted the diaper or anything else is disturbing the environment. So, increasing the duration, that is, allowing the baby to cry for a longer time, teaches the baby that mother is around. She is going to come and have a look at me. But other part also, that baby is allowing to self-soothe, right? So as we discussed, cry it out, Ferber's method, pick up and pick down, and the spacing out method. And the last method is not very popular but can be tried is the chair method. I personally don't advise this method. Why? Because in this chair method, what we do is we place the baby in the crib. The mother sits next to the crib using it in a chair. As soon as the baby cries, the mother talks to baby, calms the baby down, and again sits, but do not pick up the baby. After a couple of nights, the mother will move the chair a little bit away from the crib and repeat the same cycle. In few weeks, we will see that the mother is far away from the baby. In this method, the baby understands the mother is near me, but the mother is not coming and picking up and soothing me. So baby learns to self-soothe, understanding the mother is nearby. But the drawback of this method is that it is very difficult for the mother to see the baby cry and not be able to pick up. In Ferber's, the mother is not in the room, mother is outside the room, and she understands that only when the baby is crying for a couple of minutes, I am going in and then stopping this thing, right? So these are the different methods which we might have discussed. Now, few tips which I would like to share with you is, the first thing is consistency. Understanding all the methods and which suits best to you in particular, you need to pick that method. If you know कि नहीं, I can, अगले 4-5 दिन मेरे पास हैं और मुझे लगता है कि मैं बेबी के साथ थोड़ा डिस्टेंस बना के कमरे के बाहर रह सकता हूं और बेबी को थोड़ा सा रोने देंगे और फिर उसको पिकअप करेंगे, तो आई कैन से कि पहला जो मेथड्स है, क्राई इट आउट एंड फर्बर्स, यू कैन गो विद दैट. But suppose you're a sensitive mother and you understand ki nahi, I cannot just allow my baby to cry, then the phasing out method or picking up and placing down method or the chair method can be tried by the mothers. But as per experience, I would say the Ferbers and cry out give results very early. 3-4 दिन में फर्क आ जाता है. Baby starts self-soothing and they fall asleep. Difficult for few days, but they learn very quickly. But बाकी 3 methods में I would say it can be few weeks to a month to make the baby fall asleep, right? Tips क्या रहेंगे? That the schedule should remain the same all days. जो भी आप करते हैं वही टाइम पे बेबी को बेड पे लेके जाना है, वही टाइम बेबी सोना चाहिए. Second, it should be a calm environment. That is the light which is there, maybe of gadgets, maybe of television, maybe of mobile. It should not be available for the baby. The baby need to understand the sunrise is the daytime where everyone should be awake. So in the daytime, the curtains should be open. Let the sunlight fall in the baby. Baby needs to understand this is the daytime. And in the nighttime, baby needs to understand this is night, sab andhera. And parents also need to fall asleep with the baby at that time. It should not happen that you are placing the baby for sleep and you are awake next to the baby. So that gives a very wrong impression to the baby. Right? So these are the few things which I wanted to discuss with you. And with this, I hope you understand or you get few things that these all things has to be done. But if any questions you have, if any queries, please put it on the group. I will get back to you on this. So I have a question from Mrs. Malvika, that what about feeding at night? So usually the best time to sleep train would be 4 months to 6 months. So in first 2-3 months, we understand the baby needs to be fed every frequently, maybe 3 hours, maybe 4 hours. But 4.5, 5, 6 months is the time duration where a baby can go at a stretch for 6 to 8 hours also at night. So ideal time to sleep train would be around 4 to 6 months of age, right? In this, we need to make sure that the baby falls asleep well for nighttime and we are feeding immediately before the bedtime. There might be a possibility that baby gets up in between, but here also we will allow the baby to self-soothe for a minute or two. That is, suppose the baby falls asleep at 10 at night, but at 4 a.m. the baby gets up. You will not immediately react to that crying. You will wait for a minute or two to see whether the baby is actually hungry or baby just got up out of irritability and baby is falling asleep. If baby falls asleep, well and good for us. But after waiting for 2 minutes also the baby is still continuing to cry, that is the time when you can pick the baby up or soothe the baby down and make baby place again on the crib. That is one. Second question asked to me, that will sleep training damage my bond with the child? This question has always been appearing with my patients, that the attachment, the bond जो मेरे बच्चे के साथ मैंने बनाया है स्टार्टिंग के 3-4 महीने, will it go down? तो the answer is absolutely no. It will not cause any detachment of the baby from the mother. Rather, it will help the baby fall asleep and it will help the mother and father to fall asleep. They will have a proper sleep schedule. They will not be sleep deprived and they will be in a better condition to bond with the baby. So sleep training has not at all damaged any kind of bonding with the children, nor they have had any behavioral or cognitive effects, side effects as the child grows up. Many articles support this, right? Any other question? So the next question here is ki I have been trying to sleep train baby for so many days and my child is still crying for an hour. So you need to understand that what kind of method are you taking, right? So the first, as I discussed, that the baby, if at all you're trying crying it out of Ferber's method, here the learning time phase is very less. But what I have seen ki not many parents are consistent with it. That is, for a day they will think ki, okay, I will allow the baby to cry and leave it. But the second day they are very sensitive. They understand ki kal raat ko maine अच्छे से नहीं किया, it is not the way I need to do. And the second day, as soon as the baby cries, they go running in and pick the baby up. So when you are inconsistent with your technique, when you are not following the routine, the babies, they get confused and they do not understand what exactly has to be done. So we need to make sure that we choose one method. Any method is fine, and we need to go about with that. And every baby responds in a different manner. That is, few babies will understand within couple of days itself, whereas in few it might take couple of weeks. So we need to be consistent and patient together. That is what I would say. So the next question is ki, is it necessary to sleep train the baby? And if I don't, will it be a problem or a horrible sleeper if I don't sleep train? I wouldn't say it's a must, because what I have seen is many people have already are not aware of this and they don't do it. But some or the other way, this particular phenomena is affecting their day-to-day routine. The parents are affected, the grandparents are affected, and the child themselves, they are not very happy child. They are a little cranky, they are irritable, and that ultimately affects the way they eat, the way they are behaving around the parents. So etc. etc. things they hinder. So what I would say is sleep training definitely organizes your life and helps you to get back together and go ahead. So I would say please learn this concept and try to sleep train. I'm sure it will give a fantastic results out of it. So next question is ki, I have started sleep training at bedtime, but my child still wakes at night. So you need to understand ki what is the reason for the baby to get up. So sleep training, does that mean that the baby once falls asleep should never get up? No. The idea of sleep training is ki the baby should be able to self-soothe and fall asleep without the presence of parents. That is the whole idea of self sleep training. But after sleep training, will my baby not get up at night? No, the baby might get up at night. So it can be because of the hunger. So which can be at the early phases of 4 months or 5 months. At that time, you can definitely offer some kind of milk. It can be breastfeeding. It can be with something, katori chammach paladi, whatever you're comfortable with. If that is, baby will accept the milk and fall asleep. But suppose it is not, then you need to look into the cause. Ki what exactly is the reason my baby is getting up. So as I said in earlier point, there might be a possibility that baby gets up and within 2 minutes, without any cause, the baby self-soothes and falls asleep. If that is happening, well and good for us. If not happening, then we need to go and see, and it should be a quick see. What we will see that baby has passed any motions or any urine. Is the diaper soaked? Is any uncomfort being caused to the baby? And rule out the other causes. And once you have established that environment is safe, nothing issue is there, then you can place the baby back to the crib and let the baby fall asleep. That's what I would say. So one more question over here, that a few people say that self-soothe is a myth and I need to hold the baby more often. So I would disagree, because there have been many sleep studies across the world where, and of course, Indian parents, all whatever comes to me, they all believe in this. Ki as soon as the baby cries, we need to pick up the baby and make the baby quiet. I understand that, but I would say this particular thing implies for the first 4 months maybe, where the babies don't understand the meaning of self-soothing. After the 4 to 5 months of age, it is our time where the baby needs to understand this is the time where I need not cry and I can fall asleep on my own. So self-soothing is definitely not a myth. I have tried the sleep training with my many of my patients and they have given wonderful results. So if you want a organized life where the parents are not sleep deprived, I would say give it a try, and within couple of days you will definitely find it is beneficial for everyone. Trust me on this. Right. So one of my patient has missed the most common sleep training methods. So I will just repeat it in short. The first and foremost, which is not very popular but the results are good, is cry it out. What do you mean by cry it out? Also called as extinction method. So what does it mean? That you allow the baby to be placed on the crib. बेबी को हमने फीड दे दिया है, whatever basic routine you do before to nap वो हमने सब कर दिया है, be it bathing, be it dressing, be it changing the diaper, be it singing a song, be it reading a story to baby, or whatever routine you are following, that has been done. The baby is now drowsy, it's time for the baby to fall asleep, and before the baby falls asleep, in the drowsy phase, when the baby is awake, you place the baby on the crib. And once you are placed, you move out of the room. That is, in that room there is absolutely no one, just the baby, and you come back only when the baby is the time for feeding or it's time to get up. In between, if the baby is crying, you allow the baby to cry, you allow the baby to self-soothe, and for that period you don't go in at all. It seems harsh, it is difficult for the mother, but this is how it is. The second method is a little bit modified. It's Ferber's method, where the Ferber says, ki, okay, do everything like that. You place the baby, do your routine, place the baby in the crib and go out of the room. And if you hear the baby crying, wait for 2 minutes, go back in without picking the baby up. You soothe the baby with your gentle touch, with your voice, with your communication. And once the baby is quiet, before the baby falls asleep, you walk out of the room and wait for a couple of minutes. If baby cries again, wait for 3 minutes. Earlier it was 2 minutes of cry, now wait for 3 minutes of cry. Then go back in, soothe the child. Come out. Let the baby be calm, let the baby self-soothe. If suppose baby continues to cry, wait for 5 minutes this time. So gradually you keep on increasing the time until and unless the baby is falling asleep. So in this method, the mother is able to go inside and calm the baby, where the mother's anxiety goes down, and the baby also understands there is someone who is going to take care of me, there is my parents available, and I need to fall asleep. So Ferber is like win-win for both, and the results are very good out of this, right? The third method which I discussed is pick up and place down, where the mother goes in, picks the baby up, calms the baby down, places baby back when the awake state but drowsy state, and goes back again out. So this is the third method. Fourth method which we discussed is a chair method, where the mother is inside the room itself. The mother is not walking out of the room, but the spacing out, that is the distance between the crib and the mother, is being increased gradually over a period of days to weeks. This is difficult because the mother understands the baby is crying in front of her eyes and she's not able to pick up, because in all this phenomena what we discussed is we allow the baby to self-soothe. So these are nutshell few methods which we can try. So as I said again, the next question is ki my child falls asleep without difficulty but wakes up during the night. What should I do? So as we discussed, this topic is about self-soothing the baby. That is, baby should fall asleep. But waking up during the night time is all a different concept, where the baby can wake up due to multiple reasons. Ideally, a child who is 4 to 6 months or older should not get up. The baby should have 6 to 8 hours of sound sleep. But if the baby is getting up, we need to allow the baby to self-soothe. If the baby is not self-soothing, we need to see what is wrong, and it should be a quick process. You need to see whether the diaper is wet, if there is any uncomfort being caused in the crib, if there is any cloth over the face, or etc thing is wrong in the crib. And if everything is fine, you need to offer him the feeds, be it milk, be it the solids what you have started. And if the baby is accepting that, the baby should fall asleep after that properly. There should not be any problem. Right. So this question is very interesting, where we say, "Ki I as a mother bed shared with our child, and now we can't get her to sleep on her own." So this happens. This is what I'm talking about, people. That when you put a baby into a habit, that is, I am gonna soothe you, I am gonna sway you, I am gonna swaddle you, I am gonna cuddle you, I'm gonna give you my warmth, and you're gonna share a bed with me, the baby gets into that routine, baby gets used to that phenomena. So baby will sleep only when those nurturing things are provided to them. So to begin with itself, I'm insisting that at the age of 4 6 months, we need to be aloof, we need to walk away a bit, so that these proper habits are inculcated into them. So bed sharing, I'm not saying it's a wrong thing, but there are drawbacks. So as this drawback, that baby now is not accepting or not willing to sleep on her own. So now it's going to be very difficult to inculcate these habits. So I'm not saying it's not absolutely possible. Even though you are late, you need to start with these methods. If others have got results in maybe a week, you might get in a 2 to 3 weeks. So I would say ki even if you have bed shared your child and now the baby is not asleep, try these methods and I'm sure in couple of weeks you will be at peace. Now the baby is falling asleep. Any more questions? Right. So how long do you let a baby cry it out when sleep training? So as we said, cry it out is a method where you allow the baby to cry, but some parents ask you how long. Ideally, that once the baby starts crying you need to just leave it and go inside only when you are planning to feed for the next time, but that becomes very cruel and I cannot ask my parent that this is how you need to do. So what I tell to my patients is ki wait for 4 to 5 minutes to begin with. If in 4 to 5 minutes the baby does not calm down, you go inside, calm the baby down and come out. And with every passing day you increase the duration by 1 to 2 minutes. So maybe first week you try for 4 to 5 minutes, then again 6 to 7 minutes, then 7 to 8 minutes, maybe 10 minutes. In 10-15, once the duration of 10 to 15 minutes have achieved, I'm sure all the babies are able to self soothe. But it becomes a little problematic because allowing a baby to cry for even for 4 to 5 minutes to begin with is very difficult for a parent, but that is how it is. So in crying out method I would say 4 to 5 minutes. Right. So one question over here: what can be done for a toddler? My baby is 2 years old, and without breastfeed, he does not fall asleep. So this is a completely different approach. So what here is कि many babies are not hungry at night. They are just addicted to breastfeeding or bottle feeding. So up to the age of 1 year, we allow the mothers to breastfeed at night. But after the 1 years of age, what we understand is that it is रख देना यहाँ पे एक ही रख दे बस sorry for that. So yeah, so where I was, at the age of 1 year the mother should stop night feeding via breast and via bottle. I'm not saying that you should not feed the child. You can offer the milk in a sipper, in a glass, in a katori, via paladi, via chammach, anyhow is fine. बट आप उसको रात के समय ब्रेस्ट फीडिंग या निप्पल वाली बॉटल नहीं देंगे. द रीजन बिहाइंड इज कि योर बेबी is not hungry. Baby is just addicted to the act, to the way we are feeding the baby. So it is just that आपने नोटिस किया होगा जैसे ही बेबी को ब्रेस्ट फीड कराने चालू किए, within few seconds baby is falling asleep. The moment I give the bottle to the baby, baby ने पूरा मिल्क खत्म नहीं किया, but baby just self soothes and baby falls asleep. So it is the act of sucking that baby is falling asleep to. It is kind of an addiction. So we need not add to the addiction. So answer here is not sleep training, but here is making the baby fall asleep without those stimulus. So आपको night time पे breast feeding बंद करना है, night time पे आपको bottle feeding बंद करना है. I'm not saying daytime. Daytime पे you can continue breastfeeding up to the age of 2 years or beyond, but breastfeeding for the reason of falling asleep is wrong and we need to stop. एंड देयर इज नो वीनिंग फिनोमेना. हम यहाँ पे वीनिंग नहीं करते हैं. मेनी पेरेंट्स से कि हम ग्रेजुअली करेंगे, बंद करेंगे. नो, इट हैज टू बी अब्रप्ट. वन फाइन इवनिंग यू डिसाइड कि आज के बाद रात को इसको ब्रेस्ट फीड नहीं करेंगे. इट्स गोना बी chaotic, it's going to be very difficult, it's going to be harsh, but within 3 to 4 nights you will see that the child is disciplined and child is falling asleep without breastfeed properly. So I request, please ये करके देखिए आप एक बार, right? So if no more questions, I would like to take your leave, right? And for more updates, you can definitely follow me on Baby Chakra. I have my Insta page called as Childcare with Dr. Amit that you can follow on that. And if any more questions, you can definitely leave in the comment box and I will get back to you on that, right? Chalo, for this, I'm taking your leave. Have a good time.